Hey, it's Dr. Leonard, and I want to talk to you for a minute about one of the most preventable yet least prevented forms of cancer, and that's colorectal cancer. I know this isn't a sexy post or controversial topic, but I think it's a really important one. Colon cancer is the third most common cancer among men and women. 70% of people who get colon cancer have no family history, and among people 45 to 49 years of age, it's on the rise. The American Cancer Society recently changed their guidelines to recommending patients that are 45 years of age and older get screened for colorectal cancer. There are three ways to screen for colon cancer. The first is the standard colonoscopy. The second is a stool DNA analysis called Cologuard. And the third is something called a fecal occult blood test, which looks for microscopic amounts of blood in your stool. All of these are effective at detecting colon cancer. When caught in the early stages, colorectal cancer is treatable in up to 90% of patients. If you or a loved one needs to be screened for colorectal cancer, I encourage you to do that right away. There is no surefire way to prevent colon cancer, but there are a few things you can do to help lower your risk. Because it can take up to 10 to 15 years for the first abnormal cells to turn into colon cancer, screening is still the most powerful preventative tool we have right now. Being overweight or having obesity confers a higher risk of colorectal cancer, so maintaining a healthy weight is important. Increasing the amount and intensity of your physical activity can help lower your colon cancer risk. Overall, diets that are high in fruits, vegetables, and whole foods, and those that are lower in red meat and processed meats, help lower your risk of colon cancer. Several studies have found an increased risk of colon cancer among those who drink excess alcohol. Long-term smoking is linked to a higher risk of colorectal cancer, as well as many other cancers and health problems. A number of studies have shown that taking aspirin and other non-steroidal anti-inflammatory drugs can help reduce the formation of polyps and your colon cancer risk. These medicines have side effects though, so talk to your provider before starting this for colon cancer prevention. We're not sure if fiber, hormone replacement therapy, or vitamin supplements such as folic acid prevent colorectal cancer or not. There's a lot of debate on those topics.